So, ma'am, what was the difficulty of this exam? Like, usually people say that, it's very difficult, or the part one, part two. What, according to you, was the most difficult part, or is it really difficult? So, ma'am, as you talked about strategy, what was your strategy? And, what was the best resources or tools that you found was very helpful? What do you suggest to the other aspiring students who want to take up the USMLE exam on how do they manage their time? Because, there are few students who are not that, extra, extra studious, or not that extra intelligent, but they want to take that exam. So what would you suggest to them as a
Right.
faculty itself? Yeah. So, hello everyone, and welcome back to Academically's podcast show. I am Sunidhi Shahi, your host, and today, as our guest, we have Dr. Bhavya Reddy. She is also cleared her USMLE, and thank you so much, ma'am, for coming here and giving us your time. We are really honored to have you here.
Thank you. Thank you for inviting me here, and really happy to share my experience with everyone. Thanks a lot.
Thank you, ma'am. So, ma'am, I'll just start with the first question. I want to know your background journey on, how you started your career in medicines.
Right. So, right from very beginning, growing up in a family of doctors, I kind of was passionate to take up medicine. Then I did my MBBS from Osmania Medical College, Hyderabad, and now I'm doing my pediatric residency.
Okay, that's great. And also, you have qualified your USMLE. So, like, why USMLE? And, how was your preparation? How did you start this whole journey?
So why USMLE? Because basically everybody, we made to believe that the US healthcare system is one of the best in the world. So I wanted to have a taste of that. Yeah. And so many of my seniors in my college were preparing, so they were the initial guidance and kind of the inspiration or motivation and whom I approached. And so, yeah, during my UG days, my seniors played a big role, and all the other videos online and everything. So that culminated into beginning of the process.
Okay. So, ma'am, what was the difficulty of this exam? Like, usually people say that, it's very difficult, or the part one, part two. What, according to you, was the most difficult part, or is it really difficult?
It is definitely difficult. I have given my, entrance exams back in my home country, which is India. I prepared for USMLEs, and USMLEs are very different in a way, because it's not enough if you know the subject. Apart from knowing the subject, you need to also know how do you apply it clinically, like the question stems are very different. The approach is kind of vague. So you need to have a very strong concept in order to, eliminate the other options and pick the right one. So yeah, it is kind of difficult, but not undoable as well. I mean, you need to know how do you eliminate the other options and pick the right one. So I guess with the right strategy and the right preparation, it's not undoable, but yeah, kind of difficult.
Yeah. So, ma'am, as you talked about strategy, what was your strategy? And, what was the best resources or tools that you found was very helpful?
Right. So I would say less resources and more repetition would be the key. And resources as well, we tend to spend a lot of time going through different video lectures and all that. I feel like we should have a specific set of video lectures which we go back to back. And Q banks are more important for USMLEs because, as I said earlier, right, knowing the knowledge is not enough. You need to know how to apply it as well. So the more number of questions you do, the more you understand how the same concept can be applied in so many different ways. So solving more number of questions would be very, very important for an exam like USMLE.
Okay. And ma'am, how about the time management? Like, how much time did it take you to prepare for the USMLE?
Right. So I did my step one during my undergraduate course, and I kind of took a good 8 to 10 months because, primarily I was going to my college also at the same time. So I would say ideally anywhere between 6 to 10 months would be a good time for step one, depending on how your basics are and how you're kind of planning to go ahead. And for step two also, I would believe like anywhere between good 8 months would be good enough for step two preparation as well.
Okay. So it might take like a year and a half for the full preparation.
Yeah.
So ma'am, what do you suggest to the other aspiring students who want to take up the USMLE exam on how do they manage their time? Because, there are few students who are not that, extra, extra studious, or not that extra intelligent, but they want to take that exam. So what would you suggest to them as a
Right.
faculty itself. Yeah.
True. So I would say, right from your first year or second year of MBBS, just have it in at the back of your mind that you want to come across this kind of an exam. So the approach is very different as well. So there are a basic set of, golden resources which we follow. For example, for step one, you have pathoma. So when in second year you're doing pathology, just have that pathoma book in your hand and go through it, like from an MCQ point of view, as well as solve question banks. There's so many available right now online, right? So I would say right from your basic first years and second years, just have it at the back of your head that you're kind of wanting to give this exam, and maybe dedicate half an hour or 1 hour daily and just do some questions. Just do some questions that you're in the right track. And yeah, again, it's not undoable, as I said. Just a little practice here and there, and then the dedicated prep, and I'm sure it will be done.
Yeah. And ma'am, what is the exam patterns are like? Like, what are the question types, and what are the marking, negative, positive? Just let me know about that.
Sure. So I think step one, we have 8 blocks, and each block will be 40 minutes, 40 minutes. Sorry, 40 questions, and it will be 1 hour block. So it's going to be an 8 hour long exam, and it is kind of really tough to kind of sit through the exam. That itself requires some amount of practice and energy.
Yeah.
Also, the questions, it'll be a mixed bag. There'll be some really long and difficult questions, and there'll be some cute little 5-line sentences. So it depends on you, when you see a long question and you don't really want to spend a lot of time on that, skip and go to the next one. Do the smaller ones and then come back to the ones which you feel are time taking, or probably you don't know a lot about that topic. So it'll all be, skipping the ones you're doubtful about, and first finish off the ones that you're pretty sure about, and come back to those later. You don't want to be wasting a lot of time. It is a long exam. It will test your endurance, but yeah, if you practice for a while and sit for the exam, it shouldn't be a big task.
Yeah. And what would you suggest to the people who are, preparing with the help of mock tests or the research tests? So is it fine to go with them? How does it help the students?
So basically how mock tests help is, you kind of get an idea about what you want to expect at the main exam. You really don't want to panic, oh my god, what is it, what is that? You want to prepare yourself. And as I said, it's an 8 hour long exam. So definitely, to build your endurance also, these mock tests will help you. And also the kind of questions you can expect. Also the scoring in USMLE is kind of little different from the other exams. We don't really have negative marking, but rather it'll give you a 3-digit score based on the percentile. So it's kind of different, but again, the strategy is the same. You don't want to get the questions which everyone knows. You don't want to get them wrong. The question nobody knows, you want to attempt and just check out your luck. So that would pretty much sum it up.
Okay. And any particular high yield topics that you would like to, tell the students to focus on?
Right. So for step one, pathology is very, very important. Like if your concepts in pathology are strong, you will be able to attempt at least 60 to 70% of the paper. So pathology topics should be done very well for step one. And for step two, I would say emergencies are really important. Like anything, you pick up cardiovascular, you pick up central nervous system, whatever you pick up, they really like to go after emergencies. So emergencies are really important for step two. So to sum it up, that would be the basic, like the first two things for each exam.
Okay. And now coming back to resources, ma'am, because I'm sure many students has the question, because they, I think, rely on a lot of resources, because obviously these days YouTube, social media, books, a lot of things are there available for students, and they literally go on all those resources. So how would you suggest to those students who are just relying on as many as resources, not being able to concentrate on one, I think?
Right. So as I said earlier, less is more when it comes to competitive exams. You really want to handpick a few resources and keep revisiting them again and again. So for step one, most of us follow first aid plus UWorld plus pathoma combination, and that should be more than enough to get you through for at least 80% of the questions. The remaining 20% really depends on how good your basics are and how lucky you are on that day as well. So yeah, but for step one, the bare minimum would be do UWorld at least a couple of times, do first aid, and then do pathoma. These would be the bare minimum for step one. And for step two, you usually want to pick up a good question bank. Again, your word is good. Even Osmosis has a really good question bank. I wouldn't say all the questions of Osmosis, at least 3 hammer, 4 hammer questions of Osmosis as well. So and maybe we can see Becker videos to supplement these question banks. So ideally, this should be the strategy for step 1 and step 2. Give your mocks at least like maybe 2 months before the exam, so you know how far you have come with these resources and where you really want to put in more effort. So mocks also play a key role at the later part of the preparation.
Right. And now when we're talking about resources, so ma'am, I would also like to request you to tell us about how Academically is helping the aspiring students in the same, like
Right.
getting the resources and everything.
Right. So we have a very good team which is really putting in the efforts to bring really quality content. So again, we have enlisted very important topics which are frequently tested on the exams, and we have kind of tried to put everything together. Like we have 19 subjects in MBBS. So when we are talking about say, acute coronary syndrome, we've put everything together from pathology to medicine to pharmacology. We've tried to get everything together at one place. So that would be one high yield thing. And also then we have, right after the discussion, we've also followed it up with questions, because as we have mentioned, right, just learning and reading is not enough. Applying it in the form of questions is equally very important. So we have kind of, formulated a very few specific questions which will help for better understanding. So I feel that would be the key highlights, putting the information together and then applying that information in the form of questions.
Okay, so in that way, Academically is helping all the aspiring students. So I would also like to tell you all that you all can come and visit our website. We have like all the courses mentioned there. You can come, you can visit, and you can definitely connect with us, and we will be happy to help you in that case. So yeah, moving forward, ma'am, I would also like to come to the main question that usually people have. Like, what are the job opportunities after giving the USMLE, and what is the salary range? Like, when we live in India or any other country, what is the difference that we get in US?
Right. So coming to the opportunities after USMLE, see, it's not just about clinical opportunities. Like obviously, maximum people write for the clinical opportunities.
Yeah.
That is to do PG in a certain specific branch. Usually, we pick up internal medicine or pediatrics or neurology or pathology. These are most international friendly branches. So not just these, but you can also go for public health services. You can pick up masters in public health. You can also venture into research. If you're someone who is research oriented, you can pick up research opportunities. If you're someone who's academically oriented as well, there'll be options for you in academics. So there's a wide variety of opportunities for you in the US after the USMLEs, and you can choose one which suits your taste or your personality better. And regarding the pay, obviously, I mean, it is better there. No, this thing. And so from what I know is that you'll be paid well enough for a comfortable and luxurious life, and I'm sure you can Google up the specific numbers that are available online.
Okay, thank you so much for the information, ma'am. Yeah. So now coming to my next question, which I personally feel that is very important, because there are a lot of students who take a lot of stress, that how am I gonna do that? The whole panic situation, the pressure that they have. So coming to the main point, that it's also related to the mental health, mental well-being. They take so much pressure that even if they know the answers, they get in panic and they can't do that. So what would you like to suggest to those students who, to keep their mental health sane,
Right. So something which I even used to tell myself was that you really don't want this 8 months of preparation to go waste on the last day. Then it makes no point. I mean, no matter how much hard work you put in, it all comes down to that one day, those 8 hours. Having said that, it's not like you need to take much pressure, but you really want to calm yourself on the day. You want to be the best you know, or you want to be on that specific day. So, ideally one day before, you really want to stop studying and just kind of gain your composure together, sit through the exam and have these small exam strategies. Again, what works for me might not work for another person. That's where again mocks come in. When you're giving mocks, you realize these are the things I'm making mistakes at, whether it is time management or whether the panicky situations. Some people are fine with a long question stem. Some people feel like it's a time waste. So it depends on how you've been doing in your mocks, and you try to kind of replicate the same thing in the final exam. Just go thinking in that this is just another exam for 8 hours, and I think we should be good. Yeah.
Okay, yeah, that's I'm sure really helpful for them. So now coming to my last question, ma'am, as a faculty also, what would you like to tell to our viewers and our future USMLE candidates, as per your experience, because of course you have cleared your exam. So what would you like to tell them?
Right. So first thing is, people think that exams is just 3 months of prep, 2 months of mock, and 1 month of final dhoom dham or whatever. But
Mhm.
I would say a lot depends on your basics. You build on your basics. So it depends, like whether you're a first year or a second year med student. If you are really early into your medical career, then read your basics really well. It's not that somehow magically in 3-4 months you're going to learn everything.
Yeah.
So you want to have your basics really good at the initial phases. Then when you're starting your dedicated preparation, again, less is more. Pick resources according to your basics. Again, if your basics are strong, you can directly start with a question bank and summary videos. If you're also confident about your basics, then you really want to sit down with some good comprehensive lecture videos and start your preparation. So select your resources according to what phase of preparation you are, and then do a very good Q bank at least a couple of times, and then start your mocks. This would ideally be the journey through how you really want to go through USMLE.
Okay, ma'am. Thank you so much. I mean, I'm sure that all our viewers and our future USMLE candidates must be really happy, and they must have got a lot of informations and insights from you. So thank you so much for that. And on this note, we will end this session. So yeah, thank you, and thank you to all of you for being here. And yeah, we'll be coming up with more such sessions, more podcasts. So stay tuned, and we'll be coming up with more faculties with us on different subjects, different topics. So even if you have any topic in your mind, any confusion, feel free to comment down below, and don't forget to hit the like, share and subscribe button. And thank you so much, ma'am. Thank you.
Thanks a lot for having me.
Thank you everyone.